Dr. Syed Haider, and we have some Q&A questions that we're going to go over during our live stream Q&A that we do every week on Wednesdays around this time. And I'm just going to go through the questions that I got over the last week real quick to give you a preview of what we're going to talk about first. Then we'll come back and answer them. So Carrie asked, have you had any patients who were vax injured and had severe tinnitus afterwards recovered from their tinnitus? A preview for that answer is yes, we have. One of my first patients, actually. Anyway, we'll come back to it. John Strewing, is there anything a person can do to stop bladder cancer that's in the bladder muscle besides removal? Yes, there's a lot you can do. And again, we'll come back to the details. Colette says, has a high-pitched sound in her left ear, and she has kind of a long question, but basically that's the beginning of the question. So another one related to ear issues, which are pretty common with the vaccines and with COVID. Christine Dempsey is asking about dehydration. No matter what her labs say, it shows she's quote-unquote dehydrated. So we'll talk about that. Jonah says, started getting sick Sunday night, and I'm pretty sure I've had COVID again. I have COVID again. So acute COVID question. Cindy Josh Hammer, a friend of the channel, says, my friend's son did do the cytokine 14 test. He got a long hauler index of 86. Does this determine that he's had COVID, and what does the index refer to? So we'll talk about that a little bit. Anonymous member says, I've been poorly since March 2020, and I caught something again. So another kind of acute viral illness. And if you guys have any questions while you're watching, drop them in the chat, and we'll try to get to those right away. Okay, so going back to the first question, have you had any patients who were vax injured and had severe tinnitus afterwards recovered from their tinnitus? And we'll combine this with Colette's question, the third one, which was, I have a high-pitched sound in my left ear, and as it is happening, I get a horrible headache. I feel like vomiting, and my left eye feels blurry, and I see black gnats, or things that look like gnats, flying around. I'm dizzy, and every tooth on the top hurts. It started when I got COVID 2 times, I think. It is progressively getting worse and more often. I went to the ENT, and they said go to a neurologist. I went to the eye doctor. He said go to a general. The neurologist referred her to an eye doctor, I think. I kept going to the doctor, to the ENT, I think, because of the pain, and he would x-ray and look and could see nothing. Three weeks later, I went in again, and this time on the x-rays, it showed all my teeth were decaying and falling out. They started to just crumble in my mouth, and the pain was unbelievable. I had to have the rest pulled, and I have 7 implants now, and it even destroyed them. Now I have a temporary denture with a bunch of screws holding it in. Wow. It never did fit. I have sores in my mouth. Insurance won't cover any of it. And after I paid $5,000, he wants another $7,000 to put another one in because this one is falling apart. Why is this happening? I also had C. diff last year and had to jump through all kinds of hoops for medications. I finally got a man from a drug company on the phone, and he sent me some medications, or I would have died from it. My life is not good. I can't leave my house. My stomach has always been messed up since I got it. I've lost over 70 pounds. I could only eat goat cheese for over a year. I've been suffering for over 4 years, and I'm tired. I'm broke, just like everyone else. I had years ago gotten implants for the price of $40,000, and COVID destroyed them. How? Wow. Okay, so these aren't really related, so I'll just go back to the first question. So the first question was somewhat related, vaccine injured, or asking if I had had any vaccine injured patients who had severe tinnitus afterwards and who recovered from their tinnitus. And so, like I said, the start of this, one of my very first long haul patients, or COVID vaccine injured patients, had really, really severe tinnitus. I mean, he was going crazy. He was going out of his mind. He couldn't work. He couldn't think. He couldn't sleep. Within a week of starting ivermectin daily, it was probably like 80-90% better, and then he just basically recovered. So sometimes that'll work. Sometimes ivermectin will work. If the starting dose doesn't work, then you just increase the dose and see if that works. These are all kind of like easy ways out that work 80-90% of the time. if ivermectin doesn't work, you can try low-dose naltrexone. You can try them together. You can try a number of, herbs and supplements and vitamins and minerals and potassium. And I mean, there's a whole list of things that people have found to be helpful. Even the stellate ganglion block has been found to be helpful, although the person who does that the most, I think, for long haulers and vaccinated patients, does recommend that you spend a month or two with instead of, before you do the stellate ganglion block, you get a vagal nerve stimulator and do that for a month or two. So there's a lot of these little tips and tricks. You can change your diet. You can do an autoimmune paleo diet. You can try fasting. You can try all kinds of things. Creatine. You can try to lower the acidity level in your body. You take baking soda. I mean, there's just so many things, and we've tried to compile, the ones that have been the most helpful for people. And so you can go to mygotodoc.com/long haul Vax protocol offer. Vax is spelled with 2 X's, and you can take a look at that. It goes over all the lifestyle stuff and the supplements and the vitamins and the minerals and really everything. Methylene blue can sometimes help. So, what causes it? It's some sort of neurological dysfunction, and it may not actually be physical damage, but more like a software problem, like the software got scrambled between your brain and your ear. And there are ways to reset that software. So if you want, if all this, the easy, simple approaches don't work, then you're left with a comprehensive approach. And we can help you with the easy, simple approaches, see if that works for you. If it doesn't, then we can fix these problems. And I think we can fix any problem if the person's dedicated enough and they're willing to spend like a couple of 2-3 hours a day on their health and really, really invest into getting better. Time and a little bit of money and effort, and patience. So those are the key things. And then finding somebody like Hakeem Shabazz, who works with us, to give you a personalized protocol, and then being open-minded and willing to do it, just willing to follow directions. That's really all it takes. So if you're kind of at the second half of that, where you've tried all the things that worked for other people and nothing worked for you, then go to mygotodoc.com/Hakeem, Hakim, and he can help you out. All right, so we've got a Facebook Live question here from Vlaiku Claudia. Sorry if I butchered your name. Leaky gut and leaky brain from Epstein-Barr virus reactivation. Brain inflammation, how can we manage it? So, generally speaking, we have to understand what causes health and what makes people healthy, keeps them healthy, and what causes disease. So at a high level, basically, there are only 2 categories of causes, and those are the nutrients that your body needs and the toxins that harm you. And if you have all the nutrients you need and you don't have any toxins around, then you'll be healthy. So that's basically the long and short of it. But it's obviously gets complicated because there are, at the physical level, there are toxins and nutrients. And then at the psychological level, there's toxins and nutrients. At the energy level, there's toxins and nutrients. So you have to address different levels. And the way to start is you begin with the physical, but you have to have an eye on psychological issues as well that are manifesting physically. So you have to have a 2-pronged approach. You have to address the toxins and the nutrients. So a lot of us lack certain nutrients and forms of nourishment that we need to be healthy, emotional, physical, diet, etc. And sometimes we don't even know what those missing nutrients are that are kind of holding us back and making it difficult for our body to heal a problem like leaky gut and leaky brain. And on the other hand, we have these toxins that have built up over time, including pathogens like Epstein-Barr virus that have a toxic effect on our bodies, and other toxins, heavy metals, microplastics, pesticides, xenoestrogens, et cetera, all these different toxins that are in the environment. And then the next thing to understand is why, like, what's the meaning of the illness, right? What does it really mean? And so what an illness means is it's a message to you, essentially. And usually the illness itself, like the leaky gut, the leaky brain, the inflammation, those things in and of themselves are not bad. Those are evidence that your immune system is alive and active, and it's trying to help you. It's trying to get rid of the Epstein-Barr virus. So usually people misunderstand this, and they think that, and they're focused on the symptoms. They're focused on the leaky gut and the leaky brain instead of being focused on the Epstein-Barr virus. Or maybe they're focused on both. But they think that I have to get rid of the sensation of being sick, right? The symptoms that I have of being sick, which are from the leaky gut and the leaky brain. And that's a mistaken approach, right? Because that is your solution. It's trying to fix your problem, right? So you need to help your immune system get rid of the Epstein-Barr with the inflammation that it's trying to produce that's creating the leaky gut and leaky brain. So you don't always begin with the end result that you want, right? The end result you want is no more symptoms. But in order to get there, you have to go through the symptoms and come out the other side, right? And so this is where most people go wrong, because they do a lot of things, even like natural things, even things like, herbs and, quote unquote, anti-inflammatory herbs. Like, that's not always necessarily the best thing to do, especially, at least not, if you're doing it for the wrong reasons, right? It might be okay because it also has antiviral effects along with the anti-inflammatory effects. But the point is that sometimes you can overdo the anti-inflammatory stuff and just basically prevent your immune system from actually getting rid of the problem, even though you feel better. And so an example of this is when people just take a lot of vitamin D. They take really high dose vitamin D, and their autoimmune disease looks like it goes away. But then after like a few years or a few months or whatever, it comes back, comes roaring back. It's much worse. And it's because they mistook vitamin D, apparent vitamin D deficiency and immune inflammation and dysfunction, for the real problem, whereas the real problem was a toxin or pathogen that their immune system was trying to get out of the affected cells. So it was killing cells in order to remove the toxin or the pathogen. So, you can take this to its logical conclusion from like natural things like too much turmeric and too much of these natural anti-inflammatories, and then you can go to artificial anti-inflammatories like steroids that are even stronger, but they quote unquote work really well. The symptoms disappear, right, for some time, but the real problem doesn't disappear. The real problem actually gets worse because you stop the immune system from fighting it off. So the immune system and the body wasn't strong enough to completely get rid of it. It was kind of like a draw, right? It was just like constant battle. It's like Vietnam. It was just like going. And just let me know, guys. Let me know if I get kicked off. So anyway, what I was saying is that the immune system, and the reason that happens, the reason people can't get rid of, the reason these problems become chronic is because for decades, people have been addressing their problems in the wrong way. They've been mistaking their symptoms for the real problem, and they've been doing whatever it takes to cover up their symptoms, essentially, right? To just feel better really quickly. And that, again, can be done in quote unquote natural ways as well as unnatural or pharmaceutical ways or through surgery or whatever, right? Through hormones. And so, maybe you've been overworking, overstressed, and you just take medicine to deal with it, or you just take medicine to make yourself go to sleep, or you just take medicine, you drink to feel better, every night after coming home from work, and et cetera. Like all these issues, they build up over time, and that's why you're affected by EBV at this point in your life. Most people have EBV. It's like 97%, 98% of the population has EBV, maybe even more. And basically a normal immune system will just keep it in check, and it'll just like lock it up and throw away the key, and you won't see it ever again, right? So the reason that in your case that's not happening, it's probably not just EBV, right? There's probably a whole lot of other stuff. So this simplistic approach, you go to functional medicine, they'll be like, yeah, just, take, 4 or 5 months of an antiviral, right? Take Valtrex or acyclovir 4 or 5 times a day for 4 months. Yeah, maybe that'll work, but it doesn't really fix the real problem. The real problem is, why is the EBV affecting you the way it is? Why is your immune system not able to keep it under control on its own? And that is because of an imbalance between nutrients and toxins, right? Too many toxins, not enough nutrients, and you're left with an immune system that can't handle EBV. And again, the message to you is that the real problem is you have this imbalance of nutrients and toxins. The real problem is not EBV. The real problem is, why is your body sending you this message? It's trying to tell you that you need to address the nutrient issue and the toxin issue. So basically, you have to detox and you have to support yourself with, powerful nutrients. And there's some ways that work really well in the modern world, things like coffee enemas for helping the liver to flush out toxins, chlorella, activated charcoal, these kind of things to help bind toxins, and antipathogenic compounds like chlorine dioxide and, antivirals and, but you have to do all this stuff together. You can't just choose the thing that's the tip of the iceberg, the EBV. And then nutritional support, with things like raw liver, raw kidney, etc. Sounds gross. You just plug your nose and swallow it, right? Like, put it in the blender, plug your nose and swallow it. So, I mean, some of these things sound weird, and they are weird, depending on where you're coming from, but they work like $1,000,000. Castor oil is really particularly helpful. That's super weird. I mean, a lot of this stuff is super weird, and it's like, it takes some getting used to, but it works like $1,000,000. It works like a charm. And then, then eventually you have to address like the deeper reasons, the more subtle reasons, which are, so there's kind of like a hierarchy you could think of, going from the gross to the subtle. So gross, not meaning like puking gross, like, making you sick to your stomach because it's so disgusting. What I mean is things that are more physical, right? So things that you can see and feel and sense physically are at a kind of like a lower level in terms of a hierarchy, and addressing things on the physical level works really well, but it works best when it leads you to addressing things at an energy level, which is more of a subtle, level. But subtle only means that you have trouble sensing it, right? It doesn't mean that it's not as strong. It's actually stronger. The more quote unquote subtle you get in terms of levels of your being, the more leverage you get to fix your physical problems, if you're able to do it, right? But not everyone is, because it's hard to work at those levels. It's hard to change your emotions. It's hard to change your thoughts. It's hard to change your beliefs. It's hard, these things are much harder than just deciding to eat differently or whatever. That's hard on its own, but it's relatively, easier than changing these subtle levels of your being. So, but eventually, if you really want to fix the problem and not have it come back, then you've got to address those levels, because those are the real source of the problem. So your emotions, your emotional health, trauma from your childhood, just ways of being that you've grown up with and gotten used to. So basically, your body's not doing anything wrong. That's the important thing to understand. By this leaky gut and the leaky brain and the brain inflammation, these are not mistakes. Okay, the body's doing the right thing, and it's stuck between a rock and a hard place. That's the best it can do, given the situation that you've given it, given the lack of nourishment and nutrients and the excess of toxins that have built up over time because of some like emotional or, historic, traumatic kind of thing that has led to an imbalance in your body of energy and, physical imbalance, and has created this weakness in certain organs that has allowed the EBV to gain a foothold. So I know it sounds really, bizarre maybe and vague, but really there is no generic solution to anything. Everything is going to be specific to you. Where exactly you are in your life, what's going on, that will give us guidance in how to fix it. So I know most people listening are just going to be like, give me something easy. It's fine. Start with the easy thing. Maybe you feel better. But you got to understand that feeling better doesn't mean the problem's actually gone. And it can come back, or it can come back worse, right? If you just make yourself feel better. I mean, the reason you're in the situation is because you've had that approach your whole life of I just want to feel better so I can get back to the business of, my day to day, and I don't have time for this, just give me a pill, give me a supplement, give me an herb, um, give me a device, give me some easy way out. That's why you're in the problem in the first place. And yes, you may be able to find something that kicks the can down the road again, but eventually you're going to have to pay the piper, right? So eventually you're going to have to pay the bill for that. All right, so Mike Caldwell says, I'm working with Hakeem Shabazz. So far, so good. I had pancreatic pain when I ate. That's gone. Got many months to go, but I trust him. Yeah, he's amazing. I think he's the best in the world at getting people to really, truly heal at a deep level. You just got to be patient because it takes months, but it pays off for the rest of your life. If you can go through a few months of, spending less time scrolling on your phone and more time working on your health, then it'll pay you back for the rest of your life. Just check your screen time on your phone. However much screen time it shows you, that's how much time you have to dedicate to your health. And think about it this way, that like the really, really good things in life don't come cheap, right? Your health is the most valuable thing in your life. Because real health means emotional and spiritual health too. It doesn't just mean physical health. It's like a signpost pointing you in the direction of where you need to go to fix your emotions and your spirit, actually, not just your physical being. So it's the most important signpost in most people's lives. If you ignore it and you go around it and you just keep going the direction you want to go instead, eventually the problem may manifest not in your health, but in your personal life, in your finances, in some other area of your life. If you cover it up in your health, it may show up in the future as a worse health problem, or it may show up in your life as some other kind of problem, and you may not realize that, the universe, your being, God, a higher power, whatever, is trying to tell you something, that there's this problem that you have that you need to fix. So it's the most immediate way that you can get a message, right, that there's something wrong, because it's the most personal. Your body is the most personal, aspect of your life in this world, compared to other things that are, more kind of extensions of yourself, like your family and your finances and all these other things. You do feel, strongly about them, but you feel most strongly about your actual body and your soul and yourself, right? Your feelings and what's going on inside your head. And that's where, that's why people get health problems, to tell them where their soul, their emotions, whatever, are imbalanced and caught in creating a physical manifestation of a problem, like allowing it to manifest, essentially allowing the means in the physical world, like toxins and lack of nutrients and pathogens, to infiltrate that organ that has become imbalanced. All right, so Chris Dinesh says, can you please suggest anything for insomnia and waking up at night? MyGoToStack.com, Malungu bark. Okay, that's the best supplement you can get for insomnia, and better than most medications. Again, it's simple enough to try, but it doesn't address the real problem of insomnia. It's meant to be like a crutch or a bridge to the real solution, which is usually something related to stress and neurological dysfunction, but can be related to inflammation and stuff like that. Usually between 2 to 3 a.m. every day, I have headaches, head pressure every day, little or no bowel movements despite hydration, fiber intake, etc. Yeah, I mean, it sounds like stress, right? So, whether you like it or not, that's the answer. For 99% of the time, that's going to be the answer. You got to deal with the stress. So how do you deal with that, right? Like, it doesn't mean you have to go on vacation to Bali, right? That might actually give you more stress if you haven't dealt with the real source of your stress. What it means is you have to do other things to solve your stress, right? So You need to do some breath work, right? So you need to mitigate the negative stress. And part of mitigating negative stress, a big part of it for most people, and maybe the most important part for a lot of people, is what you believe about the situation that's stressful, right? So if there is a psychologically stressful situation, your belief about the situation can either give you a lot of stress, like uncontrollable stress, or you can have no stress. So you have to address your beliefs about reality and about the situation and about the people in it and about yourself and about your situation. Just so Hakeem Shabazz is great at that. And number two, you have to, things that are like while you're doing that, while you're trying to shift your beliefs and learning and listening to somebody and doing some, personal work and going through this process of shifting beliefs into a more positive direction, right? While you're doing that, you can address physical things. You can remove other sources of stress, because stress is there's physical stress, there's the stress from lack of nutrients, there's the stress from the toxins that are in your body and in your environment. And so you minimize all these other sources of stress so that your total body's quote unquote stress load goes down. And I'm not just talking about psychological stress. When I say stress, I don't mean psychology necessarily. It's partly psychology, but everyone's stressed, whether you feel it or not. You're stressed because of all the toxins in our environment. Those are stressful to your body, and they have a subconscious effect, even if you don't feel it consciously, because of the stress your body's under, right? And those make you less able to deal with psychological stressors and with other physical stressors. So you have to fix the stress essentially, and then there's things you can do to. So it's like a balance, right? So you have stressors and then you have stress relievers. So stress relievers for most people are going to be exercise, good sleep. Unfortunately, you're having trouble with that. Breath work, yoga, qigong, these kind of things, and spending time with loved ones in a healthy environment. Intimacy, sunlight, stuff like that, grounding. So there's a lot of things you can do to balance the equation so that you can start sleeping. In the meantime, mulungu bark is very helpful. For bowel movements, triphala is usually really helpful, and maybe triphala and turmeric, it depends. Dosing is just all across the board. You just got to start with quarter teaspoon, work up to a teaspoon, 2-3 teaspoons, and see how it goes. Mulungu bark powder, there's a concentrated version, which is the best that is on the market. That's available at my go-to stack, and you can start with a low dose and work your way up a little bit. And it can itself cause side effects. Any medicine that has really strong effects, like helping you sleep, will cause side effects. So watch out for side effects like changes in your symptoms as you start increasing mulungu bark. And the best thing to do is to consult Hakeem Shabazz and really solve your underlying deep issues. And oftentimes when people start seeing him and they really get serious about their health, their symptoms vanish within days or weeks. It's very common. So that's the answer. Julian Dworjanin says, do you have any suggestions for the unmasking of a mold toxicity post-COVID vaccine? Yeah, so again, simple solutions to real solutions, right? There's a spectrum. Ivermectin helps a lot with mold toxicity in my experience. But no sugar helps a lot too. It helps to starve it. So no sugar, it might take a few months, but you take chlorine dioxide, you take other herbs and antifungal supplements, and eventually mold toxicity is a little different thing. So mold toxicity is more about people who have a allergic reaction to mold spores in the air. What I was talking about was fungal infection. Mold toxicity. So what's going on here? You're reacting to something that you didn't really react to before, and most people don't react to mold. There's a genetic susceptibility to it, element to it, but still, the issue is why are you reacting now when you never did before? It's so the mold itself isn't the real problem, right? There's mold in the environment everywhere, right? We're exposed to it all the time, and it's like pollen, right? Like you're not supposed to react to it. It's not harming you. It's just like, it's just a innocent, member of the environment. It can start growing inside you. That's a different issue, right? That's another problem. But these things, let me see if I can follow my own reasoning that I've had before. So these things seem like they're a mistake of the body, right? But the body, again, is using this to send you a message, right? So it's using this reaction to the mold spores to try to tell you what the real problem is. The real problem is not the mold spore. The real problem is that again, it's a toxin and nutrient thing. There's a lack of nutrients and an excess of toxins other than the mold, right? So previously, there was an excess of toxins and pathogens and lack of nutrients. And this is what is setting your body up for, to cause this symptom, right? And you've identified it as a mold toxicity, but that's not the deeper root cause issue. And so there's not just one reason for somebody to have mold toxicity. And sometimes the issue can be an emotional one. So an emotional toxicity or basically emotional issue, lack of emotional nourishment, excess of emotional toxicity. And that is what is being expressed physically as mold toxicity. And so sometimes it's not even physical toxins and, lack of nutrients that is the real deeper issue. It's more of like a childhood trauma, right? And that has manifested, and it wasn't, but usually that childhood trauma does weaken a certain tissue in your body, and then that tissue attracts toxins and, loses its nutrients or runs through its nutrient, stores too quickly because it's trying to fight off the toxins. And then the mold toxicity is kind of the icing on the cake, the cherry on top that sets off the symptoms. But again, the real root cause issue is deeper, and it's a message your body's trying to tell you something. It's not making a mistake. It's not stupid, okay? It's not like confused, so none of those things are the case. It's sending you a message, and interpreting that message is what Hakim Shabazz does. That's what a real healer would actually help you do, is interpret what message am I getting based on who I am in my life and everything, like really personal stuff. What is the actual message, right? And then there's superficial enablers of the message, which if you remove the mold, the symptoms will go away. But the real root cause issue is still there, still harming you, still getting worse, trying to find another way to express itself, right? So if you cover up the mold toxicity, it will either make it worse or find some other way to tell you the same thing, okay? So that's the truth. That's just how it is. I just got to tell it how it is, even though it's not probably very popular. But that's it. I could tell you like ways to eliminate the symptoms. Get like put a special filter in every room that filters out the mold. Sure, the symptoms will go away, but then the problem will pop up again in a few years, or it'll show up in some other part of your life because the real problem wasn't addressed. The real problem is not the mold. The real problem is deeper. So you just have to accept that, in order to really heal. You have to accept that the physical problem is just pointing you in the direction of a deeper problem. And again, the COVID vax is part of it, right? You could detox from the COVID vaccine, the COVID shot, and then your mold toxicity disappears. But again, it's just an enabler, allowing that deeper part of yourself to express itself. So it's not truly just the COVID vaccine that's the problem, right? It's just a physical enabler. If you hadn't had the deeper problem, the emotional issue, whatever it is that's the deeper problem, then the COVID vaccine would not have been able to damage your immune system, or quote unquote damage, or cause these physical effects that allowed the mold toxicity to manifest. It wouldn't have been able to do that. Like, it's the weakness in your tissues caused by the energetic imbalance, caused by the deeper emotional issue or trauma or whatever, that allows the COVID vaccine to do its dirty work, right? Quote unquote dirty work. It's actually a blessing in disguise. It's actually something like where your own soul is the real issue, right? So everyone's problem is only themselves. it's not out there in the world. It's not other people. It's not evil, industrialists. It's not evil pharmaceutical manufacturers. Those aren't your problem. Okay, those things are just things that reveal you to yourself. So everything else in the world that's happening, the entire universe of causes and effects, all it does is it shows you who you are. And the problems that you perceive while interacting with the universe are just trying to uncover your own faults, your own problems within yourself so that you can fix them. And when you fix them, the problem that's in front of you, in front of your eyes, vanishes when you fix yourself. So I know it's like a woo-woo, spiritual, psychological kind of story, but that's the truth, right? That's real health. If you want to just like cover it up and deal with the problem later, pass the buck to the future and pay it back with interest, that's not real health, right? Like when I do that, which I do a lot of also, I'm trying to like gradually draw people down the path of real health. Because, and this gets to another thing, that just kind of like fixing the physical properly, like, maybe an 80-20 Pareto rule principle, right? Where somebody's not willing to do 100%, but they're willing to do like 20%, right? Instead of 3 hours a day, they're willing to spend like 30 minutes, okay, a day on their health and make some hard choices, some changes to their diet and stuff like that, but not like the whole thing. But just starting there can plant a seed to actually really, truly change, and your physical health can start to shift, and that can help shift your emotional and spiritual health in the right direction. But it's really just an invitation to change. You can still reject it, right? So as your physical health improves with some more simple, 20% of, solutions, over time, it may take longer, but you may still get a lot of benefit if you do it in the right way and you don't use the wrong means. But as your physical health starts to shift, it can make it easier to shift your emotional and spiritual and, those things. And then if you have somebody giving you some guidance, you can really create a lot of change. And then if you can shift up to those higher levels, you may not have to make as significant of a change at the physical level. If you can really start working at the emotional and psychological level, sometimes you don't need to do the work at the physical level anymore, which is, time consuming and everything and difficult. Whereas, again, the leverage you get at these more subtle levels of your being, it's a lot of leverage. It doesn't take time. It can just happen instantly, right? But how do you get to that point? It's not easy, right? There's no clear path to, whatever it is that you need to do at those levels. All right, so Sue Francis and Lorenzo Dravek, is that? I think it's all one person. Yeah, history of Lyme and co-infections from 1998. After COVID, I could not walk. Are you seeing this? I've been bedbound since January of 2021. I have no energy. I'm totally sapped in a wheelchair. Do you have a clinic? Yeah, we have an online clinic, and you really need to talk to Hakeem Shabazz. So that's basically what you need to do. And you may need help, to do this. So if you can't find somebody to help you, then you need to get like a home health care person or something. And if you can't do that in the US, then consider going to some other country where it's much cheaper. And it's like a tenth of the price or even less to hire home health care. Like, do whatever it takes. We can get you better if you're able to do the things you need to do, which, I mean, it's a lot of stuff that you're going to need to do, and you're going to usually need some sort of help if you're wheelchair bound and bed bound and completely sapped of energy. So somebody's going to have to do the juicing, and somebody's going to have to prepare the coffee enemas and the whole 9 yards, right? Somebody's going to have to give you the castor oil packs, and it's just somebody's going to have to get all the stuff ready throughout the day and give it to you. So go to mygotodoc.com/Hakeem, and there's a way out of this. I'm completely confident that if you submit to a proper protocol, you actually just say, okay, I'm just going to do what you say, you can get better. Everything can be healed. Anything can be healed until you're dead. It's just that, not every person is willing to do what it takes to heal. If you're willing to do what it takes, if you're willing to do anything, you can heal, and you just need guidance. John Strewing says, is there any, but getting back to the question, well, that was the question. Do you have a clinic? So it's online, mygotodoc.com/Hakim, Hakim. Yeah, okay. So now we're up to John String's question. Is there anything a person can do to stop bladder cancer that's in the bladder muscle besides removing it? And before we get to that, we have a few questions. Pajit says, sir, my back hurts when I sleep. Yeah, so back pain is, usually there's an element of psychology to this. So look up John Sarno's work, Healing Back Pain. And there's a wiki online that gives people, I think, like a 30 or 40 day guided journaling program that's really, really helpful. Again, it's going to sound ridiculous, but this works for back pain. You got to try it. So beyond that, obviously anti-inflammatories, castor oil packs, all kinds of stuff you can do, and just breath work and relaxation techniques and stuff like that. But, if there's some kind of like deeper problem that needs to be addressed, I don't know, I'd have to, talk to you in person to figure out what else might be going on with back pain. But it's usually something related to stress. IYC what says, how can the vaccine injured gain weight? So again, we have to address like deeper root causes. The weight loss is a sign, it's not the real problem. So we have to detox and we have to support. That's essentially the long and short of it, while we address the deeper emotional issue that's at play, right? That's been uncovered by the vaccine and allowed to manifest. And in general, right, like part of that might be like something like colostrum. If you're not reacting to milk, that's a great way to gain weight, is to drink whole milk. So you would have to address your diet, figure out what's going on with your diet and what's going on with your thyroid. What is it basically that's leading to this metabolic, ramp up in energy expenditure and, burning all the energy and the fuel, and make sure that there's nothing like cancer that's leading to weight loss. That would be the number one thing to make sure of, right? Pancreatic cancer treatment. Okay, so this brings me to cancer and the bladder cancer question. So any cancer can be healed, and it's actually, I don't think it's actually as hard to treat cancer as people think. But it takes a lot of dedication to do it right. You can sometimes get rid of cancer, but I would seriously caution against this idea that has become very prominent online, that treating cancer is super easy by just taking ivermectin or just taking fenbendazole or just taking this or that thing that you read about because one person online says that it worked for them. It does not work for everyone, okay? Even the exact same cancer, exact same age, exact same everything, it does not work. I know a lot of people personally who have tried the simple solution of just take ivermectin, just take fenbendazole, just take, this handful of things that, is going around on TikTok, and it did not work, all right? So sometimes it works, but it's the same with everything. These kind of like one-hit wonder kind of solutions, these like really easy, you don't have to change anything, do anything different kind of solutions, you will find somebody that it worked for, and that doesn't mean anything. I mean, it could be a placebo effect, it could have been anything, right? They could be lying just for, notoriety online, who knows, right? So I do think that sometimes those approaches work. I also know people for whom those approaches did work. Pretty simple, they didn't change a lot of stuff. But, it's who knows how often that works, right? I don't know. The people that it worked for are going to be the ones coming back and like posting, great reviews and everything. And the people it doesn't work for are it's just gonna be one step on their journey of like, okay, what do I try next? 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 And hopefully they end up coming full circle or turning back around and just going to a really comprehensive approach that gets at the deeper root cause issue, right? Which again is toxicity and lack of nourishment. So if you're still at the beginning of that journey and you're like, I just need the easy solution, I still believe in the easy solution, you can go to the pinned protocol blog post at blog.mygotodoc.com. So blog.mygotodoc.com. And the pinned post at the top there on that Substack shows, a simple protocol from Adam Gertner for any cancer using ivermectin and fenbendazole. It tells you exactly how to use it. You can increase the doses if you want, but it starts off pretty low. It's a 3-week cycle if you're not getting better feeling. And so this is important about cancer, that if you feel better, you should take that as good indication that you are better, even if the cancer hasn't disappeared yet, or even if the cancer looks like it's worse, because there's a rate of change for things, right? And initially the thing is accelerating, right? It's increasing at an increasing rate. It's going faster and faster and faster and faster. Every second it's going even faster than it was the second before. So as you start to take your foot off the gas pedal, right, you still might be going faster and faster and faster every second, but at a lower rate, right? So you're not increasing your speed as quickly as you were before, but you're still increasing it, right? So that in itself is a positive development. And then the next stage is that you stop increasing your speed. You just have constant speed, right? That's better than increasing speed. And then the next stage is that you have decreasing speed, right? That's even better than having a constant rate of, velocity or, speed. And then the thing stops, right? And then the thing disappears. So these are what are called like derivatives of the rate of change. So there's, the first derivative, the second derivative, third, there's like rates of change of rates of change of rates of change. And so unless you understand this, that it may, like the tumor may continue to grow, but it's no longer growing as quickly as it was before. So even though you might see the tumor continue to grow after the first 3-week cycle, it may actually have already reversed the trend and started to slow down before shrinking, right? So it's growing, and then it starts to slow down, and then it starts to shrink, and then it disappears. So that's something to be aware of. And the other thing to be aware of is you may not feel better and you still might be getting better, right? So what that means is that as you start to detoxify and as the tumor starts to release its toxins, they go into your bloodstream, they come out into your urine and your stool and your sweat and whatever. As that process is happening, you could feel really sick. And so you have to be aware that there could be severe worsening, there could be mild worsening, and then eventually you could feel fantastic, right? You've gone through the fire, all the detox and everything and the Herxheimer's and whatever, and you come out the other end and you're feeling fantastic and this tumor's still there, right? That means it's on its way out. Like you've probably solved the issue and you're going to get better and it's going to eventually disappear. Sometimes the tumor can actually vanish, but it looks like it's still there. That's another thing. Like the cancer's gone, but there's still a lump, right? And that is, it's like fibrosis and, calcification and toxins and other things but the cancer cells are actually gone. And another huge pitfall that we see that happens to people is that once you have the initial diagnosis, especially histology, like a biopsy with, pathology diagnosis under the microscope, if as long as the lump is still there, every time you send it for pathology again, they'll probably say that they see it, even if they don't, okay? Because they don't want people to think they're stupid. It's like, they'll be like, it must be there, right? Like, and they'll just kind of like imagine it into being. And what I mean is that like, there's these like on the borderline kind of like decisions you have to make when you're looking under a slide and under a microscope. It's not clear cut, okay? So cancer or pneumonia or anything that you're like trying to diagnose, it's never clear cut. Or sometimes it is, and sometimes it's not at all, right? So sometimes it's clear, but then there's this spectrum of like uncertainty, going from less and less certain to like more and more uncertain to like, okay, it's definitely not. But along that spectrum, depending on the environment that you're in, right? Depending on the context, right? If you tell somebody who's looking under a microscope at a cell this patient who this cell came from had cancer before and they still have cancer. What do you think? Is this a cancer cell from their breast? They'll say, yeah, that looks like a cancer cell. But if you tell them that this patient that this cell is from has never had cancer and they're 13 years old and they don't have family history of cancer, and do you think that this cell from their breast has cancer? They'll be like, no, it doesn't. And it's the same exact appearance. It was my point in both cases, right? It looks exactly the same. And in one case, you say it's not cancer at all. And the other case, you say, yes, it is definitely cancer. So making the decision of what to call cancer, what not to call cancer, depends on the context that you're making it within. So there's a lot of pitfalls with cancer. Hakeem Shabazz is like as good as he is at everything else. He's best at cancer. Okay, he's creme de la creme in the entire world at cancer, at really healing cancer, not giving you like a fake cure and like, you know, making it disappear for a while and then it comes back worse and whatever. Not fixing it, but then some other problem pops up. So like a real cure you'll get from Hakeem Shabazz if you follow his directions. Again, mygotodoc.com/Hakeem, Hakim. Can you point me to what a healthy diet looks like? So I'm staring blankly at the screen, but I think I'm back now, right? So yeah, can you point me to what a healthy diet looks like to get healthy at home? So the diet to get healthy is different than the diet to stay healthy. It will always depend somewhat on you. So some people will need to be low carb or like almost zero carb, and other people will need to have some carbs. So, you know, some women oftentimes need some carbs to just keep their thyroid functioning and to like keep them healthy. So it depends on, so, you know, it could be very low carb, it could be moderate carb, or it could be somewhere in between. And then usually it's going to be something similar to the autoimmune paleo diet initially while you're healing, where there's no grains, there's no dairy products except maybe ghee, maybe grass-fed butter too. So no milk, no cream, no cheese at all for sure. No, oftentimes no cooked eggs, maybe one raw egg a day, possibly, if you're not reacting to it, which most people don't. It's usually going to be no meat, no muscle meats, but there will usually be some organ meats and preferably raw. If you can't stomach, you know, actual raw, fresh organ meat, you know, then you can try the, you know, it doesn't work as well, but, you know, the powdered raw organs that they sell is another way of doing it that are encapsulated. But I just pinch my nose and force it down. And we're talking about like 40 grams of liver, or maybe 40 grams of kidney. It kind of depends on which organs you need, but usually everyone benefits from liver. And, you know, a lot of vegetables, and then green vegetable juicing, where you'd be juicing things like cabbage, broccoli, a little bit of like some ginger, maybe 35 grams of ginger, and spinach. Those are the main things that most people can benefit from. And a lot of vegetables, you know, steamed or sauteed vegetables. Again, whether they're starchy or not, depends. Some people would benefit from like sardines as an addition, but some people may need to avoid them initially. So it's kind of like you're kind of and you're eliminating all the nightshade vegetables, soy products, no sugars at all, no fruits, at least no sweet fruits. So you could have things like avocado, olives, you know, those are technically fruits, but not the sweet fruits. And I mean, there's some other things that you might need to eliminate initially, right? So it's not that these things are bad. So the nightshades, the most common ones are the tomatoes, potatoes, the eggplants, the eggplant. and so you eliminate those initially. So this is just helping your body kind of like reestablish balance and shift over into like a detox mode, spring cleaning mode. But the exact specifics of like a particular person's diet is going to depend on where they live in the world, what kind of work they do, and some other specifics of their illness and, stuff like that, right? Avoid mushrooms basically avoid mushrooms. You don't want to cook with the mushrooms. They're basically nature's toxin cleanup crew. So unless they're like grown in like a pristine environment, they're probably going to have a significant amount of toxins in them. So I think of anything other pointers here. Yeah, no grains, like I said, not just gluten-free, but just avoid grains in general. But again, some people, some really, really healthy particular grains may be beneficial for some people. Maybe like, amaranth or coconut or quinoa or whatever. It depends on where you're from in the world also, like where your ancestors are from, which quote unquote healthy gluten-free grain might be particularly beneficial to you. So those are some things that can help. Fasting definitely helps most people, and you may be able to fix most things with fasting if you're willing to do it long enough. But yes, fasting is beneficial. There's all kinds of different kinds of fasting. There's prolonged fasting where you just water fast for days, weeks, at a time. There's intermittent fasting, different kinds of intermittent fasting. You may fast 12 hours a day or for 24 hours or 36 hours, and then you may eat, for a week, and then you may fast again, or you may fast just like 15, 16 hours twice a week. You may fast 3 days a month in a row. You may fast dawn to dusk. A billion Muslims fast dawn to dusk 1 month a year, and then also sometimes throughout the year. You may have like a daily fasting window where you eat every day, but then you also have a long period of time where you don't eat. So you could have 1 meal a day, or you could have 2 meals a day within like a 4-hour window or a 6-hour window or an 8-hour window, which isn't very short at all. So there's different kinds of fasting you can look into. Obviously, usually the ones that are more extreme will lead to the quickest results for people, but some women can't tolerate fasting. So again, it depends. Premenopausal women sometimes have a lot of trouble with fasting. So it may or may not work for a particular person. Is there a way to get my lymphatic system moving? Massage, exercise, heat, and massage at the same time. But, so heat, massage, these are, really great. Sleeping on the floor, on like a Japanese kind of mat, bed mat, you could, that helps a lot. Just from like, it's like getting a constant massage all night long, right? There's this pressure on your body that you don't get from sleeping on a really, really soft bed, but it takes some getting used to, and you have to go from like the softness you're used to and gradually decrease it to the point where you can sleep on the floor. Any IVs, chlorine dioxide solution makes me feel swollen, but I do have SIRS and mold toxicity. Any idea to get it moving? And what are your thoughts on well call for mycotoxins? Integrative doctor said to take it, but I haven't, as I didn't want to take a pharmaceutical. I almost never start with pharmaceuticals. Like I would always start with natural means. So Welchol is usually prescribed to lower cholesterol. It's a bile acid sequestrant, and the cholesterol comes out in your bile. So it's kind of like a binder that gets it out of your body. So I don't have experience using Welchol in this way for mycotoxins, but basically you can start off with all kinds of binders. You don't have to start with Welchol. You can start with chlorella and a bunch of different binders that all kind of accomplish similar things. The safest and the place to start is usually with the mildest thing, and then gradually work your way up to stronger things if needed. And then also to help move the bile acid and to help move the toxins out of the liver and the body in general, coffee enemas are really helpful. So you can do things like bentonite clay and activated charcoal and zeolite and things like that. So again, you just have to support your body, and you have to deal with toxins and give yourself nourishment. And to help with that, like I said earlier, that basically to get things moving, you have to get yourself moving to move the things, right? So how do you move things? You move them by increasing blood flow with heat, and you move them by moving your body itself and by massaging the tissues. Like, this is how you get things moving. Castor oil packs can help get things moving too. So you can just put them all over your belly and chest, just everywhere, kidneys, liver, bladder, everywhere, around your neck at night. So sleep with them, and this will get things moving. Andrew says, "Hi, Doc. I'll be doing well." Hey, Andrea. Okay, weight gain. I have put on weight since losing 40 pounds initially. I was severely anemic back in the beginning of the bad injury and have gained it back, plus some. I don't eat badly, but unable to move my body much, trying to just get up out of bed. It's hard stuff. Yeah, so it can be tough. So I'd have to know the details in order to give you some advice here. It's not medical advice, but okay, in order to give you some medical or some information. So yeah, weight issues are, you have to, like, once you get started, you just go all the way to the end until you get your weight back to normal, and then you keep it there for a while, and then it becomes more stable, and it's easy to it's hard to move it again. So weight is one of those things, there's an inertia to it. Like, it's hard to get it moving, and then once it stops moving, it's hard to get it started again. But then once it starts, so whether it's going down or up, right, it's hard to get it going. But then once it starts, it's easy to keep going. But then once you start going the wrong direction, it's easy to keep going the wrong direction still. But what you want is, like, you want to get your body into the habit of being at a really, truly healthy weight. So you got to go all the way down to the really, truly healthy weight, and then keep yourself there for a while. At the same time, address all the underlying issues, right? So it's toxicity, essentially. Most of the time when people are overweight, it's due to a lack of energy rather than too much energy, right? So your body, it's kind of like a star that's like getting bigger and bigger and going to go supernova as it's nearing the end of its life. It's losing energy. So the same thing happens in your body. It's lack of nutrients, nourishment, and excess of toxicity. It's linked to all kinds of things: stressors, cortisol, which comes from stress, lack of good sleep, lack of sunlight, lack of grounding, food toxicity, and inflammatory stress and toxins, and all these things are related to weight. To help non-alcoholics, steatohepatitis, sorry, showing and unshowing it. How often should we do the coffee enemas, and how often the charcoal? I mean, the coffee enemas are just a daily thing, and the charcoal is also daily. If it's going to be charcoal, I would start with chlorella. It's a lot milder. But yeah, if you go with charcoal, have it 2 hours after the last thing that you want to actually absorb at night. So you don't want it to bind up nutrients and things. And it will anyway, but at least you don't want to bind up much of what you're actually taking and trying to get into. But it will still, draw out some nutrients and bind them along with the bad stuff. So it's best to have, like, somebody who's really skilled at this and who's done it before, like Akeem Shabazz. I'm sure the lymph is part of the issue, 100% on the toxins right now. Yep. Colette Swan, her question was, I have a high-pitched sound in my left ear, and as it's happening, I get horrible headache. So this is that question that we did. that we kind of left earlier. My left eye is blurry. I see things that look like black gnats flying around. I'm dizzy. Every tooth on the top hurts. It started when I got COVID twice, progressively got worse. And she went to all those specialists, and then her teeth started falling out and crumbling. And she had dental issues, severe dental issues. Can't leave the house. Stomach has been messed up since I got it. Lost 70 pounds. Couldn't eat anything but goat cheese for a year. Suffering for 4 years. Tired, broke. So easy answer here, right? Like, I don't want to like misguide people and make them think, okay, just go take ivermectin and it's going to cure you completely. You've probably tried it. So I really have to just say that you have to go to Hakeem Shabazz. There's no other way. And if I can convince you to do that, and he can convince you to actually do what he tells you to do and completely dedicate yourself to it, then I completely believe that you can get better from this. But what is it? Obviously, again, it's like the COVID is the tip of the iceberg. It affected you particularly strongly, caused inflammation, but there was already a problem. There had to be, right, for COVID to do this, and no vaccines. It seems like just COVID infection twice. So I would say that there was some issue with those teeth to begin with, which again goes to a higher level. Like the physical issue with the teeth begins at a higher level, right? It's an emotional issue, a trauma issue, something deeper, which allows that to manifest itself. So, and I think your story kind of points out the way that like you got the implants and then they fell out or they had problems. Like you can think that you've quote unquote solved your problem or bypassed it or gone around it or something, and it's still there, right? It's still not solved. So the actual, like the jaw bone itself, not just the teeth, is manifesting a problem. It's manifesting inflammation and an issue. So I hope you get help, and we can help you if you're willing to do the work. And just go to mygotodoc.com/Hakeem. Christine Dempsey says, have you had a problem with dehydration? Like, no matter how much I drink, I'm always dehydrated. Even my labs say that I'm dehydrated. So I'm assuming like her BUN is high, and maybe her creatinine even is a little bit higher than normal. Those are the usual things that we are called dehydration when we see them on labs, although they're not necessarily due to dehydration. So you have to take that with a grain of salt. Like you have to interpret those properly depending on the situation. But I'm drinking Smart Water, Armor Water, Essential Water, and I'm thinking this is causing a lot of my headaches and low blood pressure. I saw my cardiologist yesterday and he said add more, I'm not sure what it says here, salt maybe, and electrolytes, and see if that helps. If not, he said he will put me on a low dose of medicine to raise my blood pressure. Don't do that. I have horrible digestive problems now because of COVID. I have exocrine pancreatic insufficiency, gastritis, IBS, rapid dumping syndrome when you eat, and so you have to go to the bathroom, reactive hypoglycemia, fatty liver, and just had my gallbladder removed 2 months ago, and all of this since COVID. It's been 4 years of a nightmare. I'm just curious if anyone else who has food intolerances has good water or a way to increase my electrolytes. I can't have any sugars or artificial sweeteners either. So we have to look into the details of this situation in order to figure out, are you really dehydrated? So, when you're looking at electrolyte levels, BUN, creatinine, all these different levels, and you're interpreting them as being like wrong, or like your body is like, doesn't have enough of something, that's usually a misinterpretation. Your body has fine control over the levels of all of these things, and it's adjusting these knobs, these dials, of all these levels for a very good reason. And so if I could see exactly what you're talking about, we might be able to figure out what that reason is. Maybe there's an adrenal issue or something, and it's adjusting your sodium levels because of that. And if you force the levels back to normal, it just makes it harder for the body to adjust what it's trying to adjust because of the real problem that it's trying to address. So, doing things like surgery and like, taking medicine to raise your blood pressure. Like your blood pressure is lower for a very good reason, right? Your body's doing that in order to benefit you. And if you reverse it on purpose, if you force it to go higher, it will actually make it harder for your body to help you, and it'll actually harm you. Okay, you're thinking you're benefiting yourself, but then some new problem will develop. And this is what happens. This is like the story of everyone in modern medicine for the last century, is that their doctor tells them this thing is going to make them better, and then they come back with a new problem. Okay, maybe it made the initial problem better, but then they come back with a new problem, a new symptom. Maybe it's a side effect. Maybe it's just a new symptom, created by the, like a new disease created by the quote unquote solution to the last problem. But they always come back with a new problem of some kind, or the same problem that they tried to fix comes back worse. Jonna Stamper Johnson says, started getting sick Sunday night, and I'm pretty sure I have COVID again. I started loading up on NAC, ALA, vitamin C, liposomal glutathione, etc. I can't take ivermectin due to eye issues that I had last time I had it. Any other suggestions? I have Lyme disease as well. So, the Spike Detox supplement from mygotostack.com, that's mygotostack.com, mygotostack. So the Spike Buster supplement, it's a Spike Detox supplement. It's helpful to start, in the beginning and continue it for maybe a month or two afterwards to help get rid of the spike. And it also has some herbs that are helpful for acute infection. And the immunity booster there, the immunity vitamins supplement, and the immunity herbals. So those three are kind of like the core. Those are really helpful and beneficial. So turmeric, you can get the ashwagandha too, and that's helpful. So the turmeric and in the herbals, you have the curcumin / turmeric, and you have black seed, and you have dandelion. All of those are fantastic. So fasting can help, most likely, most people, and definitely avoiding, sugary stuff for a month or so, and taking it easy, not exercising for 4 to 6 weeks after you get better, or after you feel better. So there's still maybe inflammation. Having, maybe considering having some steroids on hand for day 7 or 8 if you're not better. If you don't want to do that, you can do an antihistamine on day 7 or 8, so Benadryl or something similar. So, there's a lot of things. It's the usual. You can go to mygotodoc.com, mygotodoc, and at the bottom of the landing page, you'll see different protocols. You can check out the acute protocol. For COVID, it's eye issues don't necessarily mean you can't take ivermectin, but you could take hydroxychloroquine instead. Nitazoxanide can help, but that's kind of more expensive. And now it's Wednesday, so it's been a few days. But in the future, the first sign of symptoms, you can always start doing things like nebulized, iodine, and you can do nasal washes and mouth washes and nasal sweeps with copper. The nasal and mouth washes with things like iodine or hydrogen peroxide and stuff like that, or even chlorine dioxide. Chlorine dioxide may also help as well for acute COVID, so taken orally as well. So those are some things that you can do, and you could start them now as well. Cindy Josh Hammer says, my friend's son did do the cytokine 14 test. He got a long hauler index of 86. Does this determine that he has had COVID, and what does the index refer to? So it's just like a mathematical, measure of the likelihood that the person had their pattern of immune system dysfunction indicates long haul illness, and so that's pretty high. That's probably the highest one I've ever seen. So it, according to them, according to their modeling and their AI modeling, their machine intelligence modeling, it indicates a high likelihood that his immune dysfunction is due to long COVID or vaccine injury, mRNA vaccine injury, or spike protein injury. So Yeah, I don't know the exact details. What is the numerator, what's the denominator of their index? I haven't gone that deep into it, but I think it's two of the markers in their panel, and they look at a ratio of them to figure. And if the top marker is very high and the bottom marker is very low, then you have a higher ratio. I don't remember which ones they were, but essentially what that means is that the lower the bottom marker and the higher the top marker, the more likely it is that the person has COVID. And so basically what that essentially is pointing to is that people with COVID tend to have their immune system activated in a particular way and deactivated in a particular way. So the immune system is an incredibly complex thing. It's like the Army, Air Force, and Navy, right? And all the different like regiments and squadrons and whatever that you have in all those different, and the Space Force and whatever, right? All, the SEAL, there's Navy SEALs and there's U.S. Marines, and then there's like the regular troops, and there's all these different there's all this complexity, and then there's all this different equipment that they can use to attack their enemies and protect their friends. There's tanks and there's guns and there's bombs and there's missiles and there's grenades and there's different kinds of grenades. So like you have the same amount of complexity in your immune system. So we're looking at different little like grenades in the immune system essentially, and we're seeing that like the immune system is stockpiling this particular grenade, but it's not, but it's like getting rid of this other particular, weapon that's not helpful in this situation. We actually, it's actually harmful. We actually need to get rid of it. It's our forces are like hurting themselves by using it. So essentially that's what the long hauler index is showing you. Okay. Let's see. You're welcome, Andrea. If it was you, would you pull RCTs and get a partial denture? BioDDS said I was probably too sick for implants, but couldn't afford it anyway. Yeah, until you're really healthy, I wouldn't consider implants. I would look at something else. So don't stick anything else in there. So first get better. Even once you're better, it's you got to carefully consider the denture and the implants, and probably not go for the metal one, but go for I think zirconia is the other one, right? The question about vitamin D, is it okay for a 1-month-old? It kind of depends on the situation. I would much rather prefer putting the baby in the sun for vitamin D. And if you need some vitamin D, and if the 1-month-old is breastfed, then the mother should have good vitamin D levels. But even then, like, it doesn't get into the breast milk. So you need to maybe add something to the milk, or like with Weston Price, the Weston Price Foundation, they make a baby milk that has I think it has vitamin D in it because of something that they blend into the milk, right? And so that's, if you can't breastfeed, then that's what you would give them, that milk, and you would get some vitamin D from that, from a natural nutrient source. But otherwise, the source of vitamin D for people is the sunlight. That's where you should be getting your vitamin D, no matter what your age is. You want to build up what some people have called the solar callus. It's not an actual callus, but like basically you want to expose yourself to the sun in the early morning and the baby together, and then in the afternoon, and then in the late afternoon. So there are these healing wavelengths of infrared light in the very early morning and in the very late afternoon that prevent the negative harmful effects of the midday sun. So 10 a.m. to 4 p.m. and you want to work up to that 10 a.m. to 4 p.m. time is the midday, and you want to work up to your exposure during that time. You don't want to do too much too soon. So gradually work your way up, and the same for the baby. So that's the simple answer. I mean, everyone should be getting their vitamin D from sunlight. Low vitamin D is just a marker of sunlight deficiency. And the reason it's important is because sunlight does a lot more than just vitamin D. Like vitamin D deficiency, or a need for vitamin D, is just one tiny little sign that you're deficient in sunlight, right? You can't solve that problem by taking vitamin D. It's only solvable by getting sunlight, okay? Because sunlight synchronizes your circadian rhythm, and it actually turns on and makes your body create certain hormones that are otherwise not created at all, okay? So you need all the wavelengths of sunlight throughout the day in order to be actually healthy, in order to grow properly as a baby, in order for your brain to function properly and to, grow properly, in order for IQ, all this stuff requires sunlight. So sunlight is the vitamin that's missing, not vitamin D. So that's important to understand. Okay. Are you only taking COVID-related questions? No, I'll take anything if I can answer. Any suggestions for recurring yeast infections? 34-year-old mother of 5. The youngest is 2 years old. Yeah, so it's usually related to sugar, right? So insulin resistance, essentially. So insulin resistance is extremely common nowadays, and it's a sign of, chronic stress on the pancreas and the body in general. It's related to electromagnetic field exposures. So, you have to fix that, essentially, right? And it's you can starve the yeast of sugar, and you might get better. You can try different kinds of douches and stuff, and natural ones and all kinds of stuff, and yogurt and whatever, right? So all of these are like band-aids, right? They're covering up the real problem, which is insulin resistance, which itself isn't even the real problem. It's deeper than that. So it's a toxin and nutrient issue. And so you can take antifungals, you can take natural antifungals, for months, and maybe you get rid of it, but then maybe it comes back a few years later. It's related to stress also, because stress raises cortisol, which raises blood sugar, which causes the yeast to grow. So it's a complicated thing. And it's very, very common. I mean, one of the most common requests I used to get when I just did general telemedicine was for fluconazole, right? And a lot of young and middle-aged women will take it every couple of months, every year, like clockwork almost. So stress, lack of sleep, all the different sources of stress, micronutrient deficiency, lack of nourishment, lack of sunlight, lack of et cetera, and toxic overload. And so it's the same approach basically to every illness, is detoxifying and supporting yourself. And at the same time, you can also use the antifungals, but you have to use them as part of a bigger protocol. Obviously, fluconazole is kind of like a steroid in that, like, you take it and the symptoms disappear, and it's like, oh, yay, I feel better. But the actual problem is probably, you need to start focusing on the insulin resistance. Probably that's the place to look at. You can get a HOMA IR score, HOMA-IR, and see where you're at. And then, initially trying to fix the insulin resistance usually requires eliminating the sugar from your diet and going low carb. But that doesn't have to be there forever. It's just until you get rid of the insulin resistance. And then you stabilize yourself, and then your body tolerates carbs again, and then you can start bringing them back. So that's the basic approach there. All right, everyone. Just want to remind people that every disease has a cure. It just requires doing what it takes to get better. And hopefully I'll see you guys next time. I think next week, we should be doing it next week. And then the week after that, I may be traveling. We'll see if I can do it or not. Okay, everyone, thank you so much for watching, and I'll see you guys next time. Bye-bye.